Most women of a childbearing age have at some stage experienced bleeding when they are not menstruating. This is a very common occurrence, and it does not necessarily mean that the woman has a health issue. The reasons for bleeding of this kind are usually linked to issues with ovulation, administration of hormonal contraceptives, a uterine pathology, or pregnancy. Ovulation issues are most frequent at each end of the age spectrum. Very young patients or patients who are going through the menopause. Patients who have polycystic ovarian syndrome or issues with thyroids can also have problems of this kind. It is common for women who are taking hormonal contraceptives to experience bleeding, particularly during the first 2 months of the treatment. Should the bleeding continue following several months of treatment, specialist gynecological advice should be sought so that the options of changing to an alternative method can be assessed. It is important to rule out the most common forms of benign pathologies, such as polyps and uterine fibroids. Occasional bleeding can happen throughout a pregnancy and particularly during the first trimester. Detecting symptoms or warning signs is the key. Specialist advice should be sought when women experience pain with the bleeding that does not recede when common pain reliefs is administered, when the bleeding is heavier than usual, when it occurs following sexual intercourse, or when the woman also experiences high temperature, vomiting, or discomfort when urinating. When bleeding occurs and the patient is going through the menopause, when the woman is pregnant, particularly if the bleeding is similar to or in excess of a period. This applies to any trimester.